Morning, Dave. Good morning, everybody. Good to be here.
Yes, indeed. And we are going to talk about ozone today, especially using ozone for pain.
Yes, and exciting stuff. You know, every week I go by and I'm having more of our guests come back with some pretty astounding results with it. And you know, what I used to do again for joint pain and traditional pain was a lot of times ibuprofen, you know, the anti-inflammatories. Maybe I'd inject the area with a steroid, that kind of thing. You know, this ozone, and it's called Prolozone, which is I use this anti-inflammatory solution, and then I followed it with the ozone gas. And this was developed by Dr. Frank Schallenberger, pioneered this he's out of Carson City, Nevada. He's an MD down there. Great guy. And, you know, when it comes to a lot of the data that's accrued over the years from the value of ozone, whether it's IV ozone, injection, it's come through a lot of his work. And again, as a reminder, ozone therapy it's a multi-pronged approach. It's given the body a stimulus. It's 3 oxygen molecules, and that little bit of gas that I inject into an area then stimulates all kinds of things in the body's activities, molecular activities, activating the immune system, increasing oxygen, stimulating stem cells, all these beautiful things to make a happy environment. And when the environment's happy, we have less inflammation, and we subsequently have less pain, or no pain in some cases. And so, you know, this last week alone, I had one gal that for a year, she had a bunch of imaging, MRIs, the CTs. Physical therapy is fantastic, but sometimes we need a little bit more in combination with physical therapy. So she tried a little bit of that. She, of course, did the anti-inflammatories, tried a steroid injection, just horrible pain that would keep her up at night going down right hip, right leg. And so she'd kind of come up against it where her quality of life was not good, not sleeping at night, then she's not recharging her batteries, and then eventually that gets into the mood. If you're not feeling well, then you start to feel depressed and anxious, and then things can spiral. So after about a year of working through the process and not really finding much for movement in the way of helping with the pain, we started to work with Prolozone. And so she was in, a couple of weeks ago, and just gave me an update, and to the point where she was having daily pain that would keep her up at night. She got to a point where she was at no pain, absolutely no pain, and she could feel it wear off, because sometimes when we do ozone injections, it takes a series. Sometimes it's 1 or 2. Sometimes it takes a series of injections to get there. And again, the beautiful thing I like about it is it's so natural. It's just 3 oxygen molecules. Super, super safe, and very simple, very elegant, very simple. And so it's extremely low risk. So she was one example, and so this is why I wanted to bring this up today, because I just know there's a lot of people out there that deal with chronic pain, and we talk about ways to address it, from hyperbaric therapy to intravenous ozone, where we take a little bit of blood out of the arm and we infuse it with the ozone gas, put it back in, and we do a series of treatments with that. There's some other topical approaches that are pretty exciting we could talk about in the future as well to help with pain. Many times, again, the message, I think it's getting out there, and so much on testimonials. So, you know, this person has come in and having success will tell their neighbor, their friend, but it's so many folks out there that would benefit from this that just keep kind of trudging on and dealing with it. And this is not just covering it up, so to speak. This is actually, because when we do a steroid shot, it's reducing cytokines, reducing inflammation, but it increases risk for osteoporosis, which is decreased bone mineral density. and it can depress your immune system, where when we do these shots, they actually augment a healing process, the body's natural healing process. So not only does it turn down the pain and in many cases eliminate it, it improves the environment. Like I said, the healing environment just gets activated. So it's cool because it's not just a pain reliever, but it's helping the body get into that state of healing. So it's covering both bases. And so when they're thinking about coming in for this type of treatment, am I a candidate for it? Pretty much, if you've got pain, this is something that you definitely want to be trying. So, one of the things, too, is coming in to see me for this. If you are not wanting to kind of go the whole road of establishing care and taking that full journey right away, which is like an hour visit with me and a bunch of lab work. So if you're like, no, I really just want to focus on this pain first, then you can actually just make an appointment with us to say, hey, I listened on the radio, KILR, and I want to start this Prolozone. And there's no fee or charge to come in and see me for that initial visit. It's just the series of injections. So it's come in right away, that first visit, and it's just because, again, we're focused on results. So I want to get you in here and get you out of this pain as quick as possible. So come on in, ask for that, where you just are saying, hey, I just want to get started on the Prolozone shots, and then it's just the cost of the injections, a series of injections for whatever that area is that's causing you pain. So we want to make it as easy as possible for folks to come in. So you may say, I want to come in and get evaluated that same day for that pain. I may go right to doing an injection that same day, that first time you come in.
Yeah. So somebody calls you up and they've got knee pain. It's absolutely killing them, or their right hip is absolutely killing them. And they don't have to wait 3 weeks to set up an appointment to come see you. They can call in and say, listen, my knee's killing me or my hip is killing me and I got to get some help here. And I heard Dr. Meyer talking about this ozone shot that I can get. Can he help me? And so that's a way they can get into the clinic.
Absolutely. And to give you an example of kind of what the process looks like, we will identify the area and that needs the oxygen therapy. I will start with a little bit of what's called an AI solution and put that in there first, and then followed by the ozone. Some folks might feel a little bit of discomfort for a minute or two after the injection. That dissipates. And then within the next 24 to 72 hours, they start to notice, some significant relief. In many cases, I have one gal that came in with chronic knee pain, and she had 80% relief after one injection. So sometimes it's one, sometimes it's a series. And the cool thing is, some cases we get to the point where there's complete pain relief for some folks, and then they only need to redo it if they, re-injure that area again or something like that. Then they may need an occasional maintenance type of injection. But again, I've seen it even a benefit folks that don't have much joint space left, where you're thinking they're just kind of wanting, or if they're a poor surgical candidate and they're wanting to put off the time to get a potential joint replacement, even those folks have been responsive. Many of those folks have been responsive to this treatment. So it's worth a visit with us to relieve that pain and at least give your body a shot to try. We want to try everything that is less invasive before, having to go. In some cases, if, folks are bone on bone joint, then that's not going to magically recreate joint space, right? So again, there are some cases where surgery is still indicated, but let's try this. I mean, if it's me, I want to try that. One other really cool story, I could sit here and probably give you about 10 to 15 different cases, but one individual, again, could not do bench press, and pretty much was resigned to in probably late 40s or so. Couldn't throw the ball, with the sun, that kind of thing, and was resigned that eventually, okay, I'm going to need the shoulder replacement. And we said, well, let's try some of these injections. And I believe individuals maybe 4 into it right now, but he is pretty close to pain-free right now, and he's back to active lifting. He's back to getting his arm over his head, so where he was limited before, not able to get that up due to the pain. Again, it's surprising to me that more and more folks are doing this. It's something you don't traditionally see in the conventional setting, meaning, in the hospital setting. But, at some day it might get there, because I think it is such a powerful tool and the results are so amazing with it.
So we are out of time, but real quick here, I was doing a little research yesterday actually on ozone. One thing that I uncovered was that the treatment ozone seems to have, especially if it works for you, it seems to have a very long-lasting effect. You take Tylenol, ibuprofen, you get a steroid shot, at some point those are going to wear off and the pain's going to come back. You talked about the healing. It promotes healing with the ozone. Not only does the pain go away, but it promotes the healing as well. And you might not come back for more ozone 6 months, a year. It's amazing, the long-term success some of these people have.
Absolutely. It's nice not to say, that pain's coming back, I got to reach for that ibuprofen. To be able to only have to use that in some cases as needed, truly as needed, not dependent on it every 8 hours to kind of get me through a day. So absolutely. Well put, Dave. Yeah.
All right. So how can folks find you or come see you, however they want to do it?
Yeah, give us a call at 712-339-6024 to set up your discovery call. That's complimentary with us. I will be on there for about 15 minutes with you to discuss a little bit about what we're about, what a path forward may look like, make sure we're a good fit, because, again, as I always say, it's a team effort, and it's the guests putting in the reps, and we're here to cheer you on, give you some recommendations, give you some tools, and it's a process that's well worth it, because that quality of life and we see go up. We strive for results, and we are getting some incredible results. So that discovery call is a great way to do it, complimentary, and so just call and ask for that. Or if you just say, hey, I'm ready to start now, I want to come in, get started on my health, and I want to sit down with Dr. Meyer for an hour-long visit and peel the layers off the onion, like we say, and get started, then you can ask for an initial visit to establish and to start to get working on things. So we are at 3305 Berquist Avenue, off Highway 71 in Spirit Lake. So really easy to find. And we, as I always say, I'm blessed with an amazing team. So a lot of folks here that love what they do, are curious about other ways to help the body heal. And when you come here, we want you to feel like family. So it's a home-like atmosphere, very non-traditional, very soothing, and a place that we've got somebody coming in today from Southeast Iowa, and their first visit, and we're going to make them feel like they're part of the family. So that's what we do for each and every individual that comes in. And so again, if you're tired of spinning the wheels and feeling like you're not making progress, maybe it's time to try something different, and give us a call.
Very good. Dr. Meyer, always a great pleasure. Have a great day, and we'll chat again soon.
Thanks, Dave. Take care, everyone.
Thank you, Dr. Meyer. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more online, okobojiwellnessclinic.com.